with Dr. Vanita Zahn.
And welcome. As the warm days of summer blend into the cooler nights of autumn, leading us to the cold of winter, we're staying indoors more frequently, and that means trouble is lurking. Already we're seeing the start of the so-called second surge of coronavirus in Europe. So what does that mean for us here in the U.S.? Dr. Stephen Hanks, the Chief Clinical Officer at St. Peter's Health Partners, is here with some answers and guidance.
These are crazy times, and numbers are going up. Some people suggest we don't look at a second wave, but rolling waves. Give us a sense as to where we stand right now, as you see it, vis-a-vis COVID.
So really, it depends on what level you're looking at. We know that globally, Benita, the case counts continue to go up at a rapid rate, and in some nations, not only the case counts, but the death rates continue to increase. The good news, though, is a little closer to home. Here in the United States, we've seen a little bit of a flattening of the rate of case growth, although in recent weeks it's been trending up again. But what's different this time is we're not seeing the death rates following the case increases like we did as the cases went up in July. We saw deaths increasing in August. Cases have been on the rise for the last 3 weeks, and we're not seeing the rise in hospitalizations or deaths that we had seen with the earlier experience in the spring and late winter, as well as in the midsummer. And this may reflect the fact that we're doing just so much more testing and surveillance testing, and a lot of the positives we're getting now are occurring in low-risk populations or asymptomatic populations that are just being tested for the purpose of surveillance, like college students. So here close to home in the state of New York and in the Capital District, our numbers remain extremely low. And in fact, regionally, we have the lowest numbers of patients in hospitals and ICU beds that we've had since the pandemic began. And we check in with the regional hospitals on a weekly basis and compare our numbers.
And we've got a little bit of a delay, so I apologize. For some, they say, well, people aren't dying, so it's not a big deal. Should we still be concerned?
Well, it's still a big deal because even with mild cases of COVID, and some people believe with asymptomatic cases of COVID, there's potential sequelae that can happen. We don't fully understand this disease. It has, one thing we do know, it is a multi-system disease. Unlike common respiratory viruses, this one doesn't have a predilection just for the respiratory system. This causes an inflammatory syndrome that can affect multiple organs in the body, and including the heart, the brain. There's evidence, for example, that there could be an increase in diabetes. We've heard about this inflammatory syndrome in children. So we don't fully understand the potential for this virus to cause other effects. So even though deaths are going down, this is still something to be extremely concerned about and very, very anxious to get going on vaccination, although that's going to take us some time.
And there's a big pushback to vaccinations. Less than 40% of the population feels comfortable, feels secure in the vaccine that will eventually be approved. What does that mean for us to tackle this and finally, put it in our rearview mirror?
Right. So assuming that we can get a vaccine that's proven to be safe and effective, the question will be deployment, and then how many people in the population do you have to vaccinate to actually stem the tide of transmission and growth in number of cases. And so the good news is you don't need 100% of the population vaccinated in order to cut off the pandemic spread of the virus. On the other hand, we also know typical vaccine safety trials run up to 2 years. And indeed, there's 4 vaccines now that are in phase 3 trials. And all of those are scheduled to run for 2 years. But I don't believe anybody is expecting that we're going to wait the full 2 years before we're deploying one or more of these vaccines. And that's where the concern is. If you think back to the situation we had in the mid-70s with the swine flu vaccination, it ended up causing cases of Guillain-Barré syndrome, a significant neurological condition that can impair breathing and led to some deaths. So we have to be cautious as we proceed. But we do believe vaccine is going to become available, and then it'll be a matter of the logistics of deployment.
How prepared is St. Peter's right now in the event of, what do they call it, the twindemic? Although I'm getting reports of large numbers of people are going in and getting their flu shots. But how prepared are you guys?
Well, I think we're very prepared, not just here at St. Peter's, but really across the healthcare system. And in fact, there's some encouraging news coming out of the Southern Hemisphere, where, as you know, they're coming out of their winter into their spring, and they had extremely low levels of flu activity this year, which we believe is a result of the fact that people are physically distancing, masking, hand hygiene, using all of the protections to ward off their risk for coronavirus. And those same activities reduce the risk of transmission of flu. It'll be interesting to see, after this is all said and done, and we hope COVID-19 will be vanquished by vaccination and or a combination of vaccination and effective treatments. We hope that when this is all done, there's a lesson here for all of us. You know, 35,000 to 50,000 Americans die every year in a typical flu season. And it makes me wonder, should we not all be masking, for example, when we're on planes or in crowded places during the height of the flu season in our country? It'll be nice to see if our social mores around that change.
Are you comfortable traveling right now?
Well, to be frank, I would be comfortable with necessary travel. I think the best advice is to avoid optional travel, particularly on airplanes. I do believe they're safe, but they're not 100% without risk. And in particular, long flights have been shown to carry a higher risk of transmission of COVID. There's a question about whether the virus can be transmitted aerosol as well as droplet. Aerosol spread is a higher risk of contagion, obviously, and may explain, for example, why less well-ventilated enclosed spaces seem to be the highest risk environments, which is why we're concerned about the return of the colder weather. But I think the best advice is to minimize or avoid travel if at all possible. But if you have to travel, I do believe the precautions that are being taken do make travel relatively safe. And obviously you have to take responsibility for your own situation, making sure you mask. Eye protection might not be a bad idea on travel, even though it's not yet been definitively proven that eye protection is helpful.
No, we just saw that South Korean study.
Data to suggest that it is.
Who wore glasses. I said we just saw the South Korean study with people who wore glasses, and the number of infections were considerably lower. So there's much to be learned. And before I let you go, Dr. Hanks, you know, when the Spanish flu hit in 1918, nobody could see that it was just going to, in essence, burn itself out. It disappeared. And there's that hope that this will happen with SARS-CoV-2. But they're different viruses. Is anybody in the medical, scientific world still holding out hope that it burns itself out and disappears?
Well, if you look at the history of pandemics, and not just the 1918 flu, but even going back to the Great Death, which is we believe was due primarily to plague, which is not viral, but in any event, most pandemics do eventually burn themselves out. It's just kind of the natural history. There's an epidemiologist, Farr, and it's called Farr's Law. Essentially, over time, for all sorts of complex reasons, these things do tend to burn themselves out. That would be our hope for this COVID-19 virus. But again, so much is unknown. We don't know about the mutagenicity of this virus in terms of its capability to assume a new form. Will it become a seasonal thing, has been suggested by some virologists. So I think it's really, really too early to tell. And I wouldn't place our bets on the hope that this is just going to burn itself out.
Time to start buying masks for Christmas gifts.
Not a bad idea.
Dr. Hanks, thanks ever so much.
You're very welcome, Benita. Thank you for having me.
Thanks for joining us. New programs post every Monday and Thursday. We'll see you next time.